Hi, everyone. My name is Ashley Pulver, and this presentation will be covering methamphetamine abuse. So, a little bit about methamphetamine. Methamphetamine is an illegal drug. It functions as a strong stimulant, which can result in feelings of euphoria, heightened mood, but also increase your heart rate and your blood pressure. There's a variation of methamphetamine that's used to treat attention deficit hyperactivity disorder, which is known as Adderall. But methamphetamine has a higher potential for abuse, and it has been shown to cause more long-term brain damage than Adderall. Methamphetamine abuse has been rising over the last decade, with hospitalizations related to methamphetamine abuse rising 245% between the years of 2008 and 2015. Methamphetamine has several names. It's also known as meth, crystal meth, just crystal, speed, or my favorite, which is redneck cocaine. So, a little bit about the background of the history of abuse. Methamphetamine was first synthesized in 1919 in Japan, and it was used by soldiers fighting in World War II to stay awake and keep their energy levels up during battle. And methamphetamine is pretty readily synthesized in the laboratory setting. It became more accessible in the mainstream society in the 1990s, and now it's largely dispersed by the drug cartels. And sometimes the methamphetamine can be laced with fentanyl, which is contributing to a rise in overdoses. Methamphetamine abuse can impact both the dopamine and serotonin neurological pathways, which results in a high incidence of addiction. And this can have lasting impacts on someone's cognition, judgment, impact their mood regulation, and also exacerbate existing mental health conditions. So, methamphetamine overdoses continue to rise each year, and 59% of overdose related deaths last year in 2024 are attributed to stimulant use. Daily methamphetamine use statistics are also continuing to rise among heterosexual men, homosexual men and women, white people, Hispanic people, and African Americans. Use among adults that are over 26 years old also continue to rise, but fortunately, there has been a decrease in use among US high school students over the last decade. And an astonishing approximately 1.6 million Americans meet criteria for methamphetamine use disorder. So this is a very serious issue. So some of the risk factors that contribute to the increased incidence of abusing methamphetamine include being male, a lower socioeconomic income status, if you're over 26, if you've completed lower levels of education, if you're experiencing housing instability, or if you reside in a suburban or rural area. And interestingly, among adolescents, those with depression, anxiety, PTSD, ADHD, and conduct disorder, so these comorbid psychiatric conditions, are at highest risk for methamphetamine abuse. Some of the psychosocial components that can contribute to methamphetamine abuse include difficult family relationships, pressure from peers just to try the methamphetamine, people who are experiencing unstable employment, or those that are exposed to violence or trauma can all play a role in the increased use of methamphetamine. Um, so some of the short-term side effects of methamphetamine include suppressing the appetite. Probably the most concerning is psychosis, nausea, tachycardia, heart palpitations, elevated blood pressure, high body temperature, experiencing panic, insomnia, erratic behavior, auditory or visual hallucinations, and seizures. Some of the long-term adverse effects of using methamphetamine include heart and brain vascular damage, damaging lungs, kidney, and the liver, impacting the dental health with tooth decay, weight loss, being disoriented, um, irreversible psychosis, depression, brain tissue damage, and just overall physical exhaustion. So patients who are struggling with methamphetamine abuse often exhibit the following symptoms, which are dilated pupils, tachycardia, or sometimes bradycardia or heart arrhythmias. Might complain of chest pain or shortness of breath, might have a high body temperature. They're most likely altered or exhibiting strange behavior. They can be psychotic or very violent. They can also have extremely high blood pressure or be having a heart attack while on methamphetamine. So, methamphetamine carries a low risk for an acute overdose, but carries a high risk for long-term mortality because of the prolonged systemic damage to the heart, the kidneys, and the brain. And dangerously, amphetamine can be contaminated with fentanyl, which can cause an acute overdose from the fentanyl that's inside the meth. And a lot of times people aren't aware that their meth contains fentanyl. Methamphetamine abuse can also contribute to a suicide attempt by 80% because the psychosis symptoms can induce some impulsive and reckless behavior. And the accompanying emotional dysregulation that also occurs can make a patient act on a suicidal thought. So patients who are battling methamphetamine abuse require a multidisciplinary collaborative approach to management. So going over a care plan for a patient who is experiencing methamphetamine abuse for pharmacological management. Right now, there is not an FDA-approved medication to treat methamphetamine abuse, but bupropion or Wellbutrin and naltrexone have been shown to be effective at reducing cravings to use methamphetamine. So I would initiate 50 milligrams of naltrexone by mouth every day. I would also plan to address any underlying psychiatric disorders that contribute to methamphetamine use with the appropriate medication, depending on what that assessment would show, such as like bipolar disorder or ADHD or depression. As far as non-pharmacological management, cognitive behavioral therapy is effective at changing thought patterns surrounding the methamphetamine abuse, help the patient to learn appropriate coping techniques to manage their cravings, and help them learn to identify and avoid triggers that might prompt them to return to methamphetamine abuse. I would also refer the patient to a detox facility for close monitoring while they are coming off the methamphetamine, as well as a CBT provider that has a substance abuse specialization that can address these issues with the patient. So for education, I would follow a harm reduction model, educate the patient on safe needle practices if they are injecting the methamphetamine, safe sexual practices, and HIV pre-exposure prophylaxis. All of that would be prioritized. I would also educate the patient on proper oral hygiene, which is important to prevent any further damage to their teeth from the methamphetamine abuse. And after they're stabilized, I would refer them to a local 12-step recovery group for patients that are recovering from drug abuse. This is beneficial for their long-term support and also other psychosocial services to address any quality of life issues that can be essential to keeping them sober long-term, such as help with employment, stable housing, get them established with a mental health care provider, things like that. And for follow-up, I would implement frequent drug testing to identify any early relapses, um, an ongoing discussion about their mental health and making any changes there that are necessary. Would also encourage healthy lifestyle choices, and all of this can reduce their morbidity and mortality rates for those that are struggling with the methamphetamine abuse. So, in conclusion, methamphetamine abuse has unfortunately risen in popularity among a variety of different patient populations over the last 20 years. And because of this, it is considered a critical public health issue. Abusing methamphetamine can cause acute symptoms of psychosis, violent behavior. Long-term use can contribute to systemic damage inside the body, impacting every organ system. And while there are no current approved medications to treat the methamphetamine abuse, naltrexone and bupropion are effective at reducing cravings, while patients do the deep work in therapy to address the root of their drug abuse, which is often unfortunately stemming from trauma or a variety of undiagnosed mental health disorders. So a comprehensive multidisciplinary approach that addresses psychological, physical, and social factors really offers the best chance for recovery and improves their overall quality of life for individuals that are struggling with methamphetamine use disorder. And these are the references. Thank you all for your time.